Hey Jai, good afternoon. Where are you right now?
I'm in Amsterdam.
Nice. I'll be flying there next week, so we will be reunited. For this chat, I want to do a brief introduction, and then we should just go into it. I have a few questions regarding microdosing and some recent studies that have been done. And I thought this is the perfect opportunity to have you on the podcast because, of course, you're working with us right now as a microdose coach. You are a neuropsychologist. You have a background in this, and I think that it's good to have someone also, with your authority to look at these questions. So perhaps you could do a brief introduction again, who you are for the people that haven't met you yet, and what you're doing with in your own life, but also with Microdose Pro.
All right. Yeah, sure. So I'm Djai, and as Nils said, I've been working with Microdose Pro for a while now, and I'm mainly responsible for the coaching program that we've set up, in which we give people who need some extra guidance in microdosing, try to give them the correct information, try to get them on the way, and try to promote sensible use of microdosing and psychedelics in general. I have studied psychology. I've got my master's degrees in clinical neuropsychology, clinical psychology, and I work as a psychologist as well in addiction care, mainly. I think that's about it.
All right, awesome. So I want to keep the setup for this episode really short. There are, in fact, only two main topics that I want to touch on. So two big questions that I also have researched in the last months more. I want to discuss that with you, and I want to provide our audience, our clients and listeners with just an open-minded experience. Like this is our view on it, our take, and we want to be full transparent. So let's dive into it. It's been a while since we've last seen each other in real life, but of course now we're closely working online together with each other. And I think this was a good opportunity for us to dive a bit more into a few questions we got lately. And the main one of that is the placebo study regarding microdosing. So I was curious if we could talk a bit about that study today and to see how you think of that, how you looked at that study.
Yeah, of course. So the study you're referring to is the citizen science study that has been published in eLife not too long ago. And the main results from this study were that they did a microdosing study. It was self-reports for psychological measures and computerized testing for cognitive measures. They wanted to see if people found any differences while microdosing, and if those differences were, if those improvements, for example, were different than a placebo group. And they did a really nice and interesting technique. It's called self-blinding. They had people put their microdoses into in gel capsules, which you couldn't see through. Had them put these gel capsules in envelopes with QR codes, and they had three experimental arms. So there was one group who got only placebos, so they got non-active doses at all. They had one group who had half-half, so a period only placebo and a period with active doses, and they had one group that was only active, so that so they had microdoses all the time. What they found was that these people, these test subjects, they improved on different kinds of psychological measures, not so much on cognitive measures, but they did show some psychological improvements on mood, improvements on well-being, stuff like that. The interesting finding they had, though, was that these groups didn't differ in how much improvement they had. So everybody said that they felt better, felt they were doing better, felt they were working better. but they couldn't find a statistical difference between those who were microdosing the entire time, between those who were taking placebos the entire time, or between those who were in the half and half group. That was really interesting. And this led to a bunch of articles from different outlets stating that microdosing is no better than placebo. And yeah, I think this is why we're having this conversation, because we get a lot of people asking us or telling us, hey, what's going on? I thought microdosing was supposed to be legit, but now it seems it's only a placebo. So it's good to spend some time on this subject.
Yeah, I think that's right. We get a lot of questions about, so is it actually real? Does microdosing actually work? And even some people that are really skeptical that say, see, I knew it was a placebo all along, and this study proves that. So I think we are both quite biased, of course, and especially as because we have skin in the game. Yeah, we have a microdosing company, so okay, we believe in this thing. But it's always good to stay critical, and also to keep an open mind toward the scientific evidence, because we have to be perfectly honest, there isn't a lot of scientific evidence regarding microdosing. There's a lot of evidence regarding the macrodosing, so that I think it's getting more clear, and there is certainly an effect there. But regarding microdosing, there needs to be done a lot of more research, and that is why I was actually surprised by the study, in the sense like, okay, I've read it, bring it on, let's see if it was a good study, if the methodology was good. Let's see if there were limitations. Let's dive into it. Let's go.
Yeah, exactly. Well, I want to start off by also saying that I am really positive about the fact that people are looking into this, right? And I'm also positive about the fact that people message us and are being critical. And I would also advise the listeners to not just take our word from it, but also do your own research, see what you can find, see what you can come up with. But about the study, right? I think, even though it doesn't really look good on microdosing, it is a really methodologically sound study. It is very well performed. So that's really nice. And there are some small things about the study, but I don't think they really reject the conclusions, right? So one of the things from the study was that this was all self-sourced or home-sourced. So the microdoses weren't supplied by the researchers or by the experimenters. So that means the participants were sourced online, right? They had to self-select. They had to say, hey, I want to join your research. I want to, I'm going to start microdosing. I want to join your research. So that also comes with the selection bias. You will have people that are already, coming into microdosing with certain expectations. The other thing is that you don't really have a clue or really have a good eye on the quality of the substance that people are using.
Yeah, so they sourced that themselves. So they got it from the black market or something, I suppose.
Yeah, exactly. So they had to get their own substances for microdosing. The majority of participants used LSD, and even though they also notified about they also put this in their own criticism in the paper itself, and they said, well, this is a limitation. We don't know the quality of the substance people had. However, it would still be representative of normal microdosing. So they didn't find much differences on placebo or from the placebo conditions, right? One thing that I was surprised in seeing was that the participants were able to guess whether or not they had a microdose or a placebo in the majority of the times. So I believe it was 72% of the participants guessed correctly, which is higher than chance.
What does that mean? How do you mean? Like they guessed correctly?
Well, that means that so they take this capsule and they don't know whether or not it contains their microdose, and then they take it, and then they will be asked, like, do you think you had your microdose today, or do you think you had a placebo today? And then afterwards, like I said, in 72% of cases, people were able to guess correctly that they had their microdose.
Yeah.
So to say that it doesn't do anything doesn't really do justice to the fact that people are able to notice when they've taken a microdose in most cases.
All right. So to hook into that, I think also the researchers, they stated very clearly that there are benefits, there are effects very clearly within the microdosing group. The only thing is that the placebo group also had these benefits, and there was not really a significant difference between those groups, right? So
yeah, exactly.
So the benefits are real. That's an outcome. That's of course that it's very nice, but then it's more what causes these benefits. That's the big question.
Yeah, exactly. That's the big question, and it's a funny discussion because, like you said, all people improve significantly on measures of psychological well-being, on mood, on concentration, stuff like that. Yeah, would you say that that's something that you rather not have because it would be a placebo?
Mm-hmm.
Or would you say, well, maybe this is a placebo, but if so, then I'm fine with it because it does work for me.
Yeah.
So that's one part of it. Another thing that I would like to bring to this conversation is the fact that this is one study, and like you said, there are very few studies actually completed about microdosing, and this is, I believe, one of the few placebo-controlled studies there is, and results have been mixed. So it isn't the case that all studies about microdosing are predominantly negative about it. True. There are some studies that haven't found big differences, or that haven't found differences from placebo, but there have also been quite a few studies, and a few studies, I must say, that do show really interesting results.
Can we go into that a bit later? I want to just first to wrap up with the London Imperial College study, is that sure. I do want to stress the fact that it's a very valid study, and I was really I want to say what really was good about the study, I think, is that the case for placebo was actually quite strong, because they also, what you said in the introduction, they did see a very strong difference within the psychological effects, like the self-perceived improvements, but in the cognitive test, they didn't see that difference, and that makes the case for placebo even stronger, because the cognitive tests are more objective. And yeah. Of course, I don't want to make the case here that this is the best study ever and it's definitely placebo, but I do want to give credit where credit is due. This is a strong case, and we have to challenge this.
Yeah, exactly. But all I can say in response to that is that we need more research, and this is also something that the authors of the study really asked for, right? So they had a number of cognitive tests that they used on the subjects. One of the things with cognitive tests is you're measuring a very small part of someone's functioning. So even though that they didn't find any significant differences here, it might be possible, and let me stress this, it might be possible that you would find differences on other measures. Another thing that people when microdosing talk about is that these cognitive enhancements they have aren't always on call, right? So you can't really, let's talk about, for example, creativity. People when microdosing often, in my experience, speak about, having more insights, being able to come up with problems come up with solutions to problems that they have, but that doesn't necessarily mean that they sit behind a computer and fix that straight away.
The lateral thinking grows. That's what you're saying, right?
Yeah, so people feel that they're a bit more free to move within their own within their mind. So what that means is they report that it's easier for them to kind of go different routes than that
Mm.
they're usually taking. But that doesn't mean that they are, for example,
Better at solving a
performing
puzzle.
better. Yeah,
Yeah, all right.
exactly.
Okay,
Yeah,
makes sense.
and even though that some of these tests really do, test specific things that you would expect to be improved because of the anecdotal reports you have on microdosing, doesn't mean that they catch these effects.
True. And one final limitation I just wanted to mention that was interesting is I was reading this Wired article also that was covering this study. And
Mm-hmm.
there was said also all these people that participated already were very experienced microdosers. And I think that's also a valid, possibly a valid limitation because these people already, they know what they're doing. They already are experienced with this whole experience of microdosing. So that could also be very interesting to see in the future, in future studies, to see, hey, is there a difference between new people and experienced people? How does this work?
Yeah, and is there a difference between people who are already scoring high on psychological levels of well-being and mood, and then they start taking a microdose and you don't see that move up or down too much? Maybe it might be the case that people already start lower on measures of well-being and mood, eventually have a bigger leap in how they score on those measures later on because of microdosing. But this is something we just don't know yet. It hasn't been researched.
True. All right. And so you were mentioning other studies.
Yeah. So and again, this is kind of cherry picking because I found studies that showed positive results, but I want to kind of put these on the scale, right, to balance it out a little bit and to show that the discussion hasn't been finished yet. So, for example, in 2019, there was a study that showed that microdosing LSD has effects on functional brain connectivity. And the authors of this study noted that these effects on functional brain connectivity might be related to changes they found in mood. And this was a placebo-controlled study. We know of the study that showed that microdosing increased levels of brain-derived neurotrophic factor, an important hormone that is thought to be responsible for aiding in neuroplasticity. We know that people with lower moods also have lower levels of this specific hormone, and that when they recover from, for example, their depression, the level of brain-derived neurotrophic factor also increases. So this makes, for me, a quite strong case to say that, hey, microdose of psychedelics could induce enhanced neuroplasticity, and enhanced neuroplasticity, we know, could help with learning new things, changing your behavior, like we said, opening up for new routes to be taken. Then to add to that, we have a study from 2020 that shows microdosing is effective in pain management. So they gave.
It's from Kim Kuipers, right?
Yeah, exactly, from Maastricht University, and they gave participants LSD in different kinds of in different dosages. So they gave them placebo, 5 milligrams, 10 milligrams, 15 milligrams, and 20 milligrams, and then they had these participants hold their hand in ice cold water. This is called a cold pressure test, and it's what they do to measure the effectiveness on of pain medication or pain interventions. I see you laughing because I know you do water exposure. But I've actually participated in one of these studies, not with microdosing, but with virtual reality for pain and pain exposure. And putting your hand in ice cold water actually gives a really strong pain impulse. So it's really uncomfortable, and they ask people to hold their hands in the water as long as they can. And what this study with microdosing LSD found was actually quite remarkable results. So it was a small scale study, and it really needs to be replicated. But the results they had, the authors concluded that microdosing with LSD was about as effective as standard opioid treatment for pain management. So that's a really big effect.
Wow. Yeah.
Yeah. Then we have another study also from 2020 that there was placebo controlled that showed microdosing did have a positive effect on cognitive function. Also had some negative effects on cognitive functioning. But this is all to say, there, in my opinion, there is evidence pointing towards microdosing having a valid effect, better than placebo. We can see these changes in brain chemistry. You can see some of these changes in brain connectivity. What this means, right, for cognitive functioning, we don't know yet. But I think it is not fair to say, well, microdosing is just a placebo because of this one study, even though it is a really sound study.
Yeah, because there's a broad spectrum of studies right now, and this is just one of them. And we just have to do more research in order to really get to the bottom of this. That's what you're saying.
Yeah, that's what I'm saying. And well, for me, in the meantime, I think I am still enthusiastic about it, and I'm still convinced that there's more than just a placebo effect. So I'm really curious to see what research will tell me. I mean, it might tell me that I'm wrong, and that in a couple of years I have to go back on these statements, and we have to redo this podcast and say, well, we were wrong all along. But
good. All right. So that's I think the placebo part, and then there's another part where we also get some questions on, and that is the point of the valvular heart disease. And this actually I wasn't quite familiar with this the last years. This is something that's quite new on my radar. I've been microdosing for over 5 years, of course with breaks, but I've been microdosing for a long time now. And this, I never really read something about this. And now since the last, I think 4 or 5 months, I'm getting more questions on this. So I started reading a little bit. What is this valvular heart disease, and how does this work, and how does microdosing play a role in that? And I was like, I need to ask Djai about this. What do you think? Is there any research to this? Is there any validity to this? Let's get it out. Like, what is this stuff, and how does that work?
Yeah. So in regards to this subject, let me start out by saying that I'm not a doctor. So don't take any medical advice from me. But no buts. Just don't take any medical advice. Don't take any medical advice from me. Let's start with that.
Cool, yeah.
And also not from any of us. Just take your medical advice from your doctor. And if you feel that, you know, if you're really doubting about whether or not you should be microdosing for, you know, a host of reasons, we always tell people, encourage them to consult their doctors to see what they say. But what I gathered from the discussion about, you know, microdosing being a potential risk for heart disease, it's because of the following reason. So we know that microdosing binds to the serotonin 2A receptor, and that's the receptor that psychedelics bind to, that are thought to explain most of their effects. We also know that psychedelics bind to the serotonin 2B receptor, and this is a different kind of receptor. And I don't want to get into the specifics of all these receptors and what they do, because that's a really difficult issue. It's very complicated. But what I want to say about this is that the reason people think that psychedelics might cause potential heart problems is because there have been substances that were known to bind to this serotonin 2B receptor. And these substances are, for example, dexfenfluramine, pergolide, fenfluramine, and fentermine. And these have been actually pulled from the markets because they were found to cause valvular heart disease, which is a serious condition. You know, people can die from that. People need operations for it. It messes up your heart, right? And that's really dangerous. So it's logical that people see this relation, right? Okay, serotonin 2B receptor binding causes heart disease. Psychedelics also bind to this serotonin 2B receptor, so psychedelics can be dangerous. I mean, there is quite sound logic in there.
And the claim is, I believe, that just one time taking psychedelics, that's okay. But if you consistently do it year after year, then you increase this risk, right?
Yeah,
right,
exactly. Yeah, you're correct. So that is the claim, and that is why the alarm bells were rung about microdosing in particular, not so much about regular dose or high dose psychedelic use, because that's more of a one-time thing, and then you don't do it for a longer period of time. You don't do it at all anymore. So I want to start off by again saying that if the evidence isn't out there yet, right? So there's no evidence that can conclusively say microdosing psychedelics is absolutely safe. You won't have any heart problems because of this. However, I do have my questions about the comparison between these substances that have been pulled from the market because of their relation in valvular heart disease, and how they compare to microdosing psychedelics. So there are some differences, right? The first difference is that these substances were taken daily for a prolonged period of time. And whereas with microdosing, if you follow our protocol, if you follow the standard protocols, you won't be using your microdose. You won't be taking it every day, right? So you take a 1 day off, 1 day on, 2 days off approach, or you take a few days on, few days off approach. There will always be breaks in between. And in most protocols, you won't be microdosing as much as you are be taking time off. That's the first part.
Any protocol I know. Now maybe Stamets protocol a little bit.
Yeah, exactly. Stamets protocol is 4 days on, 3 days off, but still, it's almost 50. It's almost 50-50.
But you take breaks in between, right? You cannot do the Stamets protocol for like 2 years in a row. That's my point.
No, exactly. No, that's another difference, right? So the first part is taking the substance every day versus taking it on different days, so not every day of the week. And the second one is we always encourage, and I think most people who work with microdosing encourage others to take breaks in between their periods of microdosing. So not only do you not take your microdose every day, you microdose for a period of 1 or 2 months, and then you take time off for 1 or 2 months again. And if you feel like it, you can start again. And this taking time off, at least for me, isn't even really with this issue of valvular heart disease in the back of my head. It's more because I feel that microdosing should give you something extra, right? And it can help you learn some new behavior, do things in a different way, and then you stop microdosing, and hopefully you've made these new pathways that you can still use even though you're not microdosing anymore. And that's the benefit of microdosing. And what happens then is you microdose for 2 months and you quit. And in this case, right, to make the case about the valvular heart disease, it could very well be a protective measure if, and this is if, the use of microdosing could potentially do something to your heart. This can be a preventative measure to go against that. Right.
All right. Okay.
Then,
Yeah.
oh, sorry.
Okay, go for it.
Then another difference or another part about this comparison is the strength of the substance. So I've tried to find online how well the comparison between these like dexfenfluramine and pergolide, how well they compare in dosage to psilocybin for microdosing, for example. And I couldn't really find any comparisons that say, well, the average dose for fenfluramine that people were using actually has the same 5-HT2 serotonin 2B receptor binding as an average microdose would have.
All right.
Right. So we don't really know yet for sure if the binding is as strong, right, as for microdosing as it would be for these other substances.
Yeah. But just for my understanding, this is just all theory, because they think, okay, these other substances, they bind it to this 5-HT2B receptor. Psychedelics also do that, like LSD more to the 2A, but psilocybin more to the 2B. We sell truffles, that's, there's psilocybin in the truffles. This also will bind to that 5-HT2B receptor, and that is why it makes sense. It's a logical argument. It's logically valid that this will also increase the risk to valvular heart disease. That's it.
Yeah.
So, but there hasn't been any studies to this, right?
There hasn't been any studies that could say that long-term uses of microdosing of psychedelics in general had more problems with valvular heart disease. There has been no case studies of psychedelic users that that have heart disease caused by psychedelics, and this is difficult because there's a fine line between saying, well, we haven't seen it yet, and it not being true.
Yeah, good
because
point.
Even though there are no case reports, as far as I know, right, for that say, well, here's patient X, and patient X has been using psychedelics and he's been microdosing, and this microdosing has caused him to develop valvular heart disease. However, that's kind of like the argument that there are no black swans because you've never seen one, right? You're not sure. But still today, for me, it does kind of create some validity to the point that it might not be as bad as some of these articles say it is. Because if it would have been this bad, we know that there are a lot of people microdosing. It has been happening for quite some time now. You would expect to see people, coming up with these problems.
Yeah, but again, that also sounds valid, but it's more speculation. We need more studies, especially to this one. Okay, so the placebo one, there are a few studies now that's up for debate. That's very interesting to see what's gonna happen there in the future. But to this specific issue, it's very technical and it's very specific, but we just don't know. And I think
you're right.
Yeah, you should make a very conscious decision for yourself. Like, is this risk big enough for you, yes or no, in order not to microdose? For me, definitely not. But that's, I think, a very personal decision that you have to make. And I don't want to make any claims about that.
No, and I mean, if I were to have, a familial history of valvular heart disease, then I would probably say, well, I'm going to skip the microdosing just to be sure.
Yeah.
And I would encourage people to do that, but just to be sure.
Yeah.
Right. And yeah, but
I'm thinking, can I interrupt? Sorry, but I'm thinking, like, I'm not sure, like, this fenfluramine, right? This is, I read somewhere, I think this is an upper. So this is quite an active substance, would really get you going, maybe like a pre-workout or something like that. Could it not be the case? I'm not sure here, but that there are also other components in that substance that could cause the valvular heart disease. So it's not just the 5-HT2B activation. Could that be the case?
Yeah, might be. Yeah.
Okay.
It might be. However, the hypothesis right now is that it's because of the 5-HT2B, but I mean, it might be that that this stuff that it's an interaction between 5-HT2B receptor binding and other variables in play as well. But
Yeah.
again, we just don't know yet.
All right. Okay, makes sense. I think we should leave it at that for now. Those are the two main questions or issues that we have at this point that we need an answer to. Like, I get a lot of these questions, and I want to be fully transparent in our communication as well. I don't want to sell something that's not true, doesn't make any sense. This is how the current situation is, and this is our view on that, our take on that, and that is right now what we have to say. Maybe in a few months, maybe in a year, 2 years, there's new evidence, there's new studies, then we have to do this again, and we can update our understanding of it.
Looking forward to it.
Great, man. Okay, thanks for having you again on your podcast, and I will see you soon in the Netherlands.
I hope so.
Awesome, man. See you. Ciao.